Acid reflux happens when contents from your stomach move back up into your esophagus. This action is also called acid regurgitation or gastroesophageal reflux. If you have symptoms of acid reflux more than twice a week, you might have a condition known as gastroesophageal reflux disease, GERD. According to the National Institute of Diabetes and Digestive and Kidney Diseases, NIDDK, trusted source, GERD affects about 20% of people in the United States. If left untreated, it can sometimes cause serious complications. GERD symptoms. The main symptom of GERD is acid reflux. Acid reflux can cause an uncomfortable burning feeling in your chest, which can move up into your neck and throat. This feeling is often known as heartburn. If you have acid reflux, you might develop a sour or bitter taste at the back of your mouth. It might also cause the regurgitation of food or liquid from your stomach into your mouth. Some other symptoms of GERD include nausea, chest pain, pain when swallowing, difficulty swallowing, chronic cough, a hoarse voice, bad breath. GERD treatment options. To manage and relieve symptoms of GERD, your doctor might encourage you to make certain lifestyle changes, like maintaining a moderate weight, if applicable, quitting smoking, if you smoke, avoiding big, heavy meals in the evening, waiting a few hours after eating to lie down, elevating your head during sleep by raising the head of your bed 6 to 8 inches. Home remedies for GERD is Dr. Sebi approved alkaline colon and detox herbs you can find in the link below or visit www.veganchoicefoods.com. Risk factors for GERD. While again, there's no one cause of GERD, there are lifestyle choices and certain health factors that can make a diagnosis more likely. These include living with obesity, being pregnant, living with a connective tissue disorder, smoking, frequently eating large meals, consistently lying down or going to sleep shortly after eating, eating a lot of certain types of foods, like deep-fried or tomato products, drinking certain types of beverages, like soda, coffee, or alcohol, using an abundance of nonsteroidal anti-inflammatory drugs, NSAIDs, like aspirin or ibuprofen. Alcohol and GERD. Alcohol consumption and GERD have been connected in many studies, and it seems like the more alcohol you drink, the higher the likelihood you might develop GERD. While the connection is not crystal clear, does alcohol affect the LES directly, or do people who drink a lot of alcohol also have other behaviors that can lead to GERD? What is clear is that limiting alcohol intake, or stopping it completely, after you've been diagnosed, may provide some symptom relief. Gastroesophageal reflux disease, GERD, is a common condition in which the stomach contents move up into the esophagus. Reflux becomes a disease when it causes frequent or severe symptoms or injury. Reflux may damage the esophagus, pharynx, or respiratory tract. Symptoms of GERD. The main symptom of GERD is heartburn, often described as a fiery feeling in one's chest, and regurgitating sour or bitter liquid to the throat or mouth. The combination of heartburn and regurgitation is such a common characteristic of GERD that formal testing may be unnecessary. Other symptoms of GERD include non-burning chest pain, which is usually located in the middle of the chest and radiates to the back. Difficulty swallowing, dysphagia. Atypical reflux symptoms relating to the throat, larynx, or lungs. Sore throat. Coughing. Increased salivation. Shortness of breath. Acid reflux happens because a valve at the end of your esophagus, the lower esophageal sphincter, doesn't close properly when food arrives at your stomach. Acid backwash then flows back up through your esophagus into your throat and mouth, giving you a sour taste. Acid reflux happens to nearly everyone at some point in life. Having acid reflux and heartburn now and then is totally normal. But, if you have acid reflux/heartburn more than twice a week over a period of several weeks, constantly take heartburn medications and antacids yet your symptoms keep returning, you may have developed GERD. Your GERD should be treated by your healthcare provider. Not just to relieve your symptoms, but because GERD can lead to more serious problems. What are the main symptoms of GERD, chronic acid reflux? The main symptoms are persistent heartburn and acid regurgitation. Some people have GERD without heartburn. Instead, they experience pain in the chest, hoarseness in the morning, or trouble swallowing. You may feel like you have food stuck in your throat, or like you are choking, or your throat is tight. GERD can also cause a dry cough and bad breath. What is heartburn? Heartburn is a symptom of acid reflux. It's a painful burning sensation in the middle of your chest caused by irritation to the lining of the esophagus caused by stomach acid. This burning can come on any time but is often worse after eating. For many people, heartburn worsens when they recline or lie in bed, which makes it hard to get a good night's sleep. Fortunately, heartburn can usually be managed with over-the-counter, OTC, heartburn/acid indigestion drugs. Your healthcare provider can also prescribe stronger medicines to help tame your heartburn. What do I do if I think I have GERD, chronic acid reflux? With GERD, when reflux and heartburn happen more than once in a while, the tissue lining your esophagus is getting battered regularly with stomach acid. Eventually, the tissue becomes damaged. If you have this chronic acid reflux and heartburn, you can see it's affecting your daily eating and sleeping habits. When GERD makes your daily life uncomfortable in this way, call your healthcare provider. Although GERD isn't life-threatening in itself, its chronic inflammation of the esophagus can lead to something more serious. You may need stronger prescription medications or even surgery to ease your symptoms. How common is GERD, chronic acid reflux? GERD is very common. The condition and its symptoms touch a huge number of people, 20% of the U.S. population. Anyone of any age can develop GERD, but some may be more at risk for it. For example, the chances you'll have some form of GERD, mild or severe, increase after age 40. You're also more likely to have it if you're have overweight/obesity, pregnant, smoking, or are regularly exposed to secondhand smoke, taking certain medications that may cause acid reflux. Visit www.veganchoicefoods.com for a cleanse and detox to fix this problem and move to an alkaline diet, link below in the bio.